Hello, I'm Dr. Lewis Hoffman. This brief video lecture is on existential and humanistic psychology, integration, and contemporary issues. This was developed for a class in the foundations of existential and humanistic psychology. However, I wanted to make it available to people who were not in the class as well. What I'm going to cover in this class is basically two issues. One is I'm going to talk about integration and eclecticism. I'm going to differentiate these and talk about why that's important. And then I want to talk about a couple of select contemporary issues in existential and humanistic psychology. When we look at the idea of eclecticism was a very popular approach in psychotherapy for a while. When applying for internship applications 15, 20 years ago, it was often encouraged that people put their theoretical orientation as eclectic, and that was viewed as a positive thing quite often. However, there's some limitations with eclecticism. The idea of eclecticism is often you're pulling various different things together and you're just trying them out to see what works. There's not as much of a formalized process to thinking about what you're doing when or how they fit together, which can be confusing to a client because sometimes things don't fit together as well as they might seem on the surface. So the eclecticism, it's very pragmatic, but sometimes in some really problematic ways. When you shift this to looking at integration is looking at how do we draw from different approaches to help enhance our approach. But there's a foundation to it. And there's a thought process about how do these different approaches fit together and how we're going to utilize them in conjunction with each other. So it's a much more sophisticated approach, and it's less likely to create confusion for clients because we're not approaching things in a consistent manner. And this can apply in other settings outside of therapy as well when we're applying theories, whether it be in leadership roles or coaching roles or management roles. When we are just trying out these different things haphazardly without a thought about how they fit into a foundation, they often are not as effective. I think one of the great models for integration is Schneider's existential integrative model. What he's talking about is using existential humanistic therapy basically as a foundation, and then we integrate from there. And Bruce Wampold, one of the leading outcome researchers, he, in his review of Schneider's book on existential integrative therapy, said that in his view, existential humanistic therapy could be an ideal foundation for all therapy, which is a pretty high compliment coming from someone like Bruce Wampold. So with this, what we're really doing is we're starting off getting that foundation. So that foundation in an existential humanistic approach. We're developing a foundation of those skills. Now, this can be in a teaching setting. This can be in a coaching setting. This can be in a leadership setting. This can be in a management setting. This can be in a psychotherapy setting. I'm going to focus a little bit more on the psychotherapy setting here, but it can apply in various different places. And Schneider's model is intended for that psychotherapy setting. But I think that general integrative model has application elsewhere. When you look at foundations of existential humanistic therapy, well, we talk about presence, developing that idea of presence and utilizing that, working with the here and now, being genuine and authentic, being empathetic. A lot of these things can be seen as that foundations of the existential humanistic approach. Those are consistent. And then we pull in from other areas at times, things that may work. Well, personally, I'm very concerned about any therapist that becomes a theoretical fundamentalist. And you can do this in any orientation, though it's more common in some orientations. And what I mean by a theoretical fundamentalist, that can be, for example, a cognitive behavioral fundamentalist. That CBT is the right way, the right approach for everyone. It's the only right way to do therapy, and it's the only way that I utilize. We can also see that within an existential approach, that people could say, I use an existential humanistic approach, this is my understanding of it, I do only this, and I'm not flexible at all. Well, when we get into that mindset, it often limits our ability to be effective with clients. In leadership settings too, I think you can see where that limits our ability to be effective leaders. There's times where we need to be flexible and adapt to the situation, and we can draw upon other forms of therapy. But we want to do it in a way that is going to be beneficial, that is thoughtful. So one of the examples I like to give is when we look at theories of emotion. Now, with an existential humanistic framework, we take an approach to emotions that emotions are something that are natural. We all have emotions. Anxiety is a common one that's often used with this. But anxiety is an important guide in psychotherapy. And what we want to do from an existential humanistic perspective is align with the anxiety, help the client use the anxiety to get a deeper understanding of themselves and use that to make informed decisions about how they want to approach life. Now, obviously, that's a pretty complex process that's mentioned very succinctly here. But this is something that is very fundamental to an existential humanistic approach in a lot of ways. Now, when you look at some other approaches to therapy, such as a lot of the early approaches to cognitive behavioral therapy, this is changing with some of the newer approaches to cognitive behavioral therapy that have shifted in something that's a lot closer to an existential and humanistic perspective. So I don't mean to overgeneralize. But in earlier approaches to cognitive behavioral therapy, and the way that it's still often applied, is that some of the techniques, the cognitive reshaping, some of the behavioral interventions, they're seen to control and manage emotions. And that's a different way of approaching emotions, that there's an attempt to try and reduce them. And that's the primary goal. If we reduce those emotions, and therapy is successful. Well, from an existential perspective, it's a little different. We do hope that there's a reduction in the uncomfortable emotions over time. But that's not the primary first purpose, not the way that we work to it. First, we listen to and understand the messages of that, and then we use that understanding to make a deeper change. Now, the belief from an existential humanistic perspective is by making that deeper change, we are going to address these problematic emotions and other symptoms in a more sustaining way, in a longer term way, because we're getting to the root of the problem instead of dealing with the symptom. Now, certainly other approaches may debate with that, but that's generally what we're going to see as an existential and humanistic assumption. So does this mean that we cannot utilize something like cognitive behavioral therapy integrated into an existential humanistic approach? Well, no, not necessarily. We can integrate them. But when we integrate them, we want to think, how do I integrate it in a way that's consistent with this foundation? So when I integrate this, I talk with clients about it. And I let them know that there are some techniques we're going to use. I wouldn't use this language with clients, but there are some cognitive behavioral techniques that we can use that may be beneficial here. Now, when doing something like that, I'm a very collaborative therapist, which is typical of an existential integrative approach as well. So I'm going to talk with the clients about this, and so that they have input into this. I'm not going to force something onto clients, in other words. But I'm going to talk with them about this can be beneficial. And I'll let them know that for some therapists and approaches of therapy, these techniques are used to help just get rid of emotions. And I'll help explain to them that, in the approach that I take, what I generally encourage people to do is these can be useful in helping manage emotions that are overwhelming, so that they can begin to listen to them. When emotions are too intense, sometimes if we don't find some ways to modulate them, some ways to feel confident that we can survive them, that we can tolerate them, it's difficult to go into them and listen to them and learn from them. That makes sense. There's nothing wrong with that. And so it may be at times that cognitive behavioral interventions might be very effective in doing this. But what I want to let the client know is that what we're trying to do in this approach is to use this to help modulate the emotions, help them develop confidence in their ability to tolerate emotions and have some ability to control and manage emotions so that we can go into them more, not get rid of them. I also always let them know that it's up to them. If they want to use these just to manage the emotions and they don't want to do that deeper work, that's their choice. But I explain to them the way that I typically work. So it's very collaborative in the sense that I'm giving them that choice there. I'm helping explain it to them so they can make an informed decision about the way that I approach it and why. And then if they're in agreement, that's kind of the approach that we're going to take. So this is a way of integrating something that maybe would create a lot of confusion in an eclectic approach. When you're in one moment helping clients listen to the emotions and talk about their how they can provide important messages to us, and in the next moment we're trying to manage them. Might not be even a confusion that clients are aware of, but they may just get the sense that something seems confusing here. but they also may experience it more directly. With that integrative approach, we're continually being thoughtful about this foundation, and then we're integrating it in a way that's consistent with that foundation, but that foundation always remains primary and in our stance and our approach to working. The exception, of course, as I noted, is when clients want something different. Then we have to consider whether we can work within that way, make those adaptations, or whether it'd be best to give them an option of a referral to someone else that might be more well-versed in that. So for example, if we're talking about some of these things early on in therapy, and it's evident that a client really is just looking for that quick solution, skill-based approach. Normally I talk about that in the first session, so I'm going to identify that in the first session, but let's say in this case I didn't. And it becomes evident as we talk about this that they're really looking for that. Then what I will tell them is that, this is not really the approach that I have as much expertise with. There are other people who are much better with that approach, and I can refer you to one of them, or we can try and work together and modify as best I can to your particular needs, and give them the option there. I think, again, that's an important aspect of that collaboration. So one more thing with this. If we're going to do an integrative model, so for example, the existential integrative model, or we could talk about a humanistic integrative model just as easily. As we look at these, what is important is first we really develop that strong foundation in an approach before we start integrating. So what I often encourage people to do when I'm working in supervision is really develop that foundation very strong, so that from a more pure existential humanistic perspective. And then we start integrating it. And we do it gradually, and as we do that, it's often helpful to be in supervision or consultation to help think through some of those aspects of it, to make sure that it's really fitting together and we're really thinking about the issues that we need to there. So this is why integration is important, and we can find a lot of different approaches that can be well integrated with the existential and humanistic approaches. Schneider's book is a great guide for this. He talks about a number of different integrations, from psychoanalytic to CBT to cultural, that within this existential integrative model. Okay, but we want to start with that foundation there. Okay. So now we're going to move on to some contemporary issues. What I think, and I'm certainly biased towards this, what I think is the most critical contemporary issue in existential and humanistic psychology is multiculturalism and diversity. Some colleagues and I have a book that's going to be coming out on this in October of 2019, Humanistic Approaches to Multiculturalism and Diversity. And we've been working on this book for 10 years. And I think it's important that it took 10 years. And this is part of why it's important for humanistic and existential psychology today, too. When we first started presenting about this and talking about this at humanistic conferences and different places, what we found was that there really wasn't much out there that had been done on this. Early on, there was some good work in the early days of humanistic and existential psychology, but it failed to fully actualize. The way that I'll often phrase it is that humanistic and existential psychology were among the first to espouse a strong valuing of multiculturalism and diversity, and I think it was a genuine, authentic valuing of it. But they failed to actualize it. It did not come through successfully. And as a result, the field has been very Eurocentric and has been dominated by a lot of white male voices. When we started working on this book, there wasn't enough foundation in the humanistic and existential literature to build from, really to do a quality book on this topic. And this was part of what delayed the book, as well as other factors, of course, but this is part of what delayed the book for a number of years. And now, I think as it comes out, there is enough of a basis in the scholarly literature to build from for this book. But what we're really trying to do with this, too, is to build from this. See, this is a stepping stone that reflects a lot of what has happened in existential and humanistic psychology around multiculturalism to the current time, but we really want this to be a stepping stone to go deeper into this work and to develop further scholarship on it. So this is really, I think, a critical topic. There are some articles that you'll read that focus on multiculturalism and diversity that are for the class. I think there's two that focus on this. One is an existential analysis of the Black Lives Matter movement. This is an article that has been one of the most downloaded articles in the Journal of Humanistic Psychology since it's been published. The most downloaded of all time, actually. So it's had a lot of traction in there, and it's looking at the Black Lives Matter and contemporary protest movements through an existential and humanistic lens, and seeing how they're doing from an existential perspective to some degree, but also talking about some opportunities there. So you'll get a chance if you're in the course to read that. If you're not, if you look up Black Lives Matter and Hoffman and Granger, there are also Vallejos and Motes were co-authors of that, but you'll be able to find it. It was in the Journal of Humanistic Psychology. A couple other important contemporary issues that I think are worth highlighting. One is neurophenomenology. What we're seeing in the field of psychology today in general is that the neuropsychology movement has really taken off, and the emphasis on trying to move psychology in the direction of a STEM science is gaining a lot of traction. This is something that a lot of humanistic and existential psychologists speak out against. It's not being against STEM sciences, but rather, do we really want to reduce psychology to being just a STEM science? It's a little broader than that, though there certainly are ways that we can work with a lot of the principles of the STEM sciences as well. So this is one of the ways that humanistic and existential psychology then has found to engage with the neuropsychology. Neurophenomenology, there's some different perspectives on this, but it's getting at some of the difference between what we experience in our brains, for example, and our psychological experience. Just because we know that a part of our brain is activated doesn't mean that we can fully describe someone's experience. And that's often what's assumed. So the neurophenomenology is really looking at the phenomenology of our neuropsychological experience, you could say. So this is an important new trend in humanistic psychology. There is an article you'll read on this in the Handbook of Humanistic Psychology for the class if you're in there. If you are not in the course, you might look up an article by Brent Robbins on neurophenomenology in the Handbook of Humanistic Psychology, and there are a number of others who have done some nice work in this area. Next, evidence-based practice in psychology. This is a controversial topic in humanistic and existential psychology, and there's a bit of a history to this. And it's talked about a little briefly in the article that you'll read on this topic for the class. Humanistic and existential psychologists have tended to react strongly against evidence-based practice. Some of this is because of the history of the empirically supported treatment movements. Now, unfortunately, some of these criticisms have not adequately distinct evidence-based practice from the empirically supported treatment movements. Now, but also we need to point out that evidence-based practice, as Wampold and Levant and others predicted, has regressed in its definition and understanding to something closer to what the empirically supported treatments were. Not quite as rigid, but moving back in that direction. The empirically supported treatments really emphasize the importance of randomized clinical trials and quantitative research in demonstrating efficacy of therapy. Evidence-based practice is much broader. And if you go back to the original article on evidence-based practice in psychology, published in the American Psychologist by the APA Task Force on Evidence-Based Practice in Psychology, you'll see a broader, more inclusive understanding that is much more supportive of different approaches to understanding what evidence is, including qualitative, including looking at the components of therapy and the basic competencies instead of trying to reduce it to a manualized approach. So evidence-based practice in psychology has the potential to be much broader and more inclusive. But because people that would value a broader and more inclusive approach have been silent, it's really regressed back in many ways to being closer to the empirically supported treatments. I think this has been a sad occurrence, and I wish there would have been more of us that were publishing and advocating for a broad, inclusive understanding of evidence-based practice. When that approach is taken, a broad, inclusive approach, then when we look at humanistic and existential psychology, they have strong foundations in the evidence, in the research literature, in this broader conception. So there's nothing we need to be afraid of about evidence-based practice in that broader understanding. But we need to stay engaged with how evidence-based practice is defined. And so this is what's talked about in the article read in class. If you are not in the class, it's an article in the Journal of Contemporary Psychotherapy by myself, Lisa Vallejos, Hedlund Claire Hoffman, and Sean Rubin on evidence-based practice and existential psychology, and you can look it up in there. Now last is diagnostic alternatives. Humanistic and existential therapists tend to prefer not to diagnose and have some qualms, philosophical qualms with diagnosis. These philosophical qualms with diagnosis gained a lot of traction a few years ago during the time leading up to the publication of the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. There were a lot of serious concerns about this manual when it was coming out. And the Society for Humanistic Psychology really led the way in voicing these concerns with an open letter that became a petition, received a large number of signatures, received some national attention, including in the national media. Also internationally, as we worked some with the British Psychological Association and a number of national and international psychological organizations. So this was an important movement that really highlighted a lot of the limitations of diagnosis with the DSM-5 or the ICD-10. This has had an impact on the field. Many are more cautious about diagnosing and have changed their approach. And it's led to consideration of diagnostic alternatives. The Society for Humanistic Psychology a number of years ago hosted a summit on diagnostic alternatives, and there have been several special issues of the Journal of Humanistic Psychology looking at issues with diagnosis and diagnostic alternatives. So this is something that's really an important issue in humanistic psychology. It is one of the issues that has really helped bring humanistic psychology back into more prominence and more recognition in the broader field of psychology because of the leadership that we took. Particularly important here was Sarah Kamens, Brent Robbins, David Elkins, Frank Farley, and some others within the Society of Humanistic Psychology in leading the way on promoting these diagnostic alternatives and critiquing the DSM and ICD for some of their limitations. So these are some of the contemporary issues that I think are important to look at, that are pointed to. What I would encourage you to do is think about what are the contemporary issues that you recognize, and think about, have humanistic and existential psychology adequately engaged on these important contemporary issues in the field of psychology, or do we need to do more work to reach out and engage in them? And I think this is going to be a critical issue. One that I think certainly could consider is trauma as another one. Now there are some good articles and books out there that draw from humanistic and existential perspectives on trauma, including a recent book by, it was by Eileen Serlin, Stanley Krippner, and I'm going to forget who the third editor of the book was, but Stanley Krippner has done some other books on this. Eileen Serlin has done a number of presentations and articles and chapters on this, as well as there's a number of others of us that have been looking at ways to approach trauma. So that might be another one that we want to engage in greater depth. But be thinking about other issues you think we need to be doing that with. As future leaders in the existential and humanistic movement, it's important to be identifying these. We also need to think about them outside of the therapy realm. How do we apply this, for example, to activism and advocacy? That's an important issue right now. How might we apply these to political engagements? Kirk Schneider has done some work with this with the Experimental Democracy Project and his work on the polarizing mind. How do we apply this in leadership settings? There has been some work on that through the years, but maybe some of that needs updating. So be thinking about these issues as you go through the final weeks of this course. If you're not in this course, I still think it's valuable for you to think about these and engage us with the Society of Humanistic Psychology or the Rocky Mountain Humanistic Counseling and Psychological Association or other associations and conferences. Get involved, present on these topics, or encourage presentations on these topics so that we can further develop some of these, our voice on some of these important contemporary issues.